Hello everyone, today we'll be studying about the dental auxiliary. So let's define it. The dental auxiliary is a person who is given responsibility by the dentist so that he or she can help the dentist to render the dental care, but who is not himself or herself qualified with the dental degree. Classification. The revised classification, it is non-operating auxiliary and operating auxiliary. Non-operating auxiliary has the dental surgery assistant, dental secretary or receptionist, dental laboratory technician, dental health educator. The operating auxiliaries include school dental nurse, dental therapist and the dental hygienist. School dental nurse. This is an operating auxiliary who is permitted to diagnose the dental disease and plan and carry out certain specific preventive and the treatment measures, including some of the operative procedures in the treatment of the dental caries and the periodontal disease in the defined group of the people, usually school children. Duties: oral examination, then oral prophylaxis, topical fluoride application, advice on the dietary fluoride supplements. Next, administration of the local anesthesia and extraction of the primary teeth. Next, cavity preparation and the placement of the amalgam filling in the primary and the permanent teeth. Then pulp capping. Next is individual patient instruction in the tooth brushing and oral hygiene. Classroom and the parent-teacher dental health education. Referral of the patient to the private practitioner for more complex services such as the extraction of the permanent teeth, restoration of the fractured permanent incisors and the orthodontic treatment. Now, dental therapist. This is an operating auxiliary who is permitted to carry out to the prescription of a supervising dentist certain specified preventive and the treatment measures, including the preparation of the cavities and the restoration of the teeth. The duties include clinical, caries diagnosis, cavity preparation in the deciduous and the permanent teeth, vital pulpotomies under the rubber dam in the deciduous teeth, extraction of the deciduous teeth under the local anesthesia. Now next is the dental hygienist. The dental hygienist is the operating auxiliary licensed and registered to practice the dental hygiene under the law of appropriate state, province, territory or nation. The dental hygienist works under the supervision of the dentists. C.M. Wright in the year 1902 suggested for the first time, and the man who puts such idea into the practice was Dr. Alfred Civilian Fons or Dr. Fons. In the year 1905, the Fons trained Miss Irene Newman in the procedure of the dental prophylaxis. In the year 1906, she was at work in the Dr. Fons office and became the first dental hygienist. The Dr. Fons is considered to be the father of dental hygiene. So the duties include cleaning of the mouth and the teeth with a particular attention to the calculus and the stains, topical application of the fluoride sealants and the other prophylactic solutions, screening or preliminary examination of the patient as individual or in a group such as the school children or industrial employees so that they may be referred to the dentist for examination and instruction in the oral hygiene. Four-handed dentistry. The term four-handed dentistry is given to the art of sitting both the dentist and the dental assistant in such a way that both are within easy reach of the patient's mouth. They both are in the easy reach of the patient's mouth. The patient is in the fully supine position. The assistant will hand the dentist the particular instrument he needs. She will also perform the additional tasks such as the retraction or the aspiration. The dentist can thus keep his hands and eyes in the field of the operation and work with the less fatigue and greater efficiency. The dentists who do not expect too much from their assistant prefer to train them on the job. The training courses do exist, extending a period of 1 year to 2 years. Now, some of the duties of the dental assistants are reception of the patient, preparation of the patient for any treatment he or she may need, preparation and provision of all the necessary facilities such as the mouthwashes and the napkins, sterilization, care and the preparation of instrument, preparation and the mixing of the restorative materials including both the filling and the impression materials, care of the patient after the treatment until he or she leaves. Now next is preparation of the surgery for the next patient, preparation of the documents to the dental surgeon for his completion and filling of these, assistance with the X-ray work, and the processing and the mounting of the X-rays. Instruction of the patient where the necessary in the correct use of the toothbrush. Aftercare of the person who have had the general anesthetic.